So hello everyone, my name's Jodi Croft. I'm an OBGYN from Wollongong, Australia, and today I'm talking to Dr. Berg. Dr. Berg, I understand you're a chiropractor who's now a full-time YouTube channel?
Yeah, YouTube blogger. So practiced chiropractic for 29 years, and now I do full-time videos. So I have 5,000 videos to educate people on health and the ketogenic lifestyle, as well as intermittent fasting. So that's pretty much what I do. That's what I love doing. Right now we're getting 600,000 views a day.
Wow.
So we're getting the message out. We do a live show on Friday, and it reaches 50 different countries. So I'm really excited to spread this word out to the world.
And how many subscribers do you have on YouTube? I know that's an important thing.
I have 3.5 million subscribers.
Wow.
And
about to get one more.
I hope if you could press that subscribe button.
Yeah, like and subscribe.
Exactly, right.
Okay, so how long have you been doing the YouTube, did you say?
I've been doing YouTube since 2008.
Okay, and have you been on ketogenic diet all that time?
No, I started out doing every single possible diet you could possibly imagine, but here I was having a little pizza crust around my waist and realizing that here I am helping people with losing weight, but I had a problem. I didn't want anyone to find out about it, so it forced me in practice to search out things that I wasn't doing, and I discovered keto, and I discovered a healthy version of keto, and then I started looking at intermittent fasting. So the combination of that really worked for me and my clients. So it's been evolution. So it's been refined over the years, and to the point where we have something that's very workable and it's very simple. And so I'm not changing it now because it's working. If it doesn't work, I will change it. Yeah.
So you do ketogenic diet within your life. Do you share it with your family or your friends?
No, I keep them separate. No, I'm just kidding. Yes, I absolutely share it with my family. Yeah. It's mandatory for everyone to do it if they're my family. Now I'm talking about the immediate family, but not the extended family. Most of my family are on it. It's very important, especially our new baby granddaughter, Lucy. We have her on. She's a really healthy keto baby. And you're talking about pure health and vitality with all the nutrients and low carb. This kid is thriving. So I really am interested in getting these children off the formulas and things and getting them on the right plan, breastfeeding and then the right nutrition early on to decrease the risk of diabetes down the road. Yeah. So that's a real passion of mine.
Yeah. So that's a real challenge, is getting children on low carb diets. I know that myself. I have 5 children, and they're boys, and they're very active. And I just find my husband and I, we do low carb or keto diets together, and then we just add carbohydrates to the kids' meals. And I just don't know how I would ever take that away from them, or how I could get them to eat enough fats and proteins in order to reduce that.
Right. How old are they?
14, 12, 10, and 2 8-year-olds.
Yeah, that's the problem. You have to start them off when they're 5 months.
Yeah, right.
Because they're set in these ways. Teenagers is really, really hard.
Yeah.
People think that children need a lot of carbohydrates. Yeah. I mean, you can have some, but definitely not the refined carbs.
Yeah.
So the best time to start is when they're born. I mean, think about a baby. They start out in ketosis, and then even a mother who's breastfeeding, she's in ketosis. So, the sooner the better. But it's all about education. You keep educating these kids until finally they, by their own accord, decide to change. So that's what we did with our kids, because we had to run the same thing. And then I slowly did it without force, and saying, and then I also just don't have junk food in the house. So they're searching the cupboards, but they're educated now. They're all in their 20s, so they're good.
Yeah, so they do it within their own lives, and then hopefully they'll progress that onto their children, I guess.
Yes.
Yeah. Have you done any videos on the effects of ketogenic diet in pregnancy, or with gynecological problems?
Well, here's the thing. When you're pregnant, if you start doing the carbo loading, you've heard of gestational diabetes, right?
Yeah.
Well, that can be totally prevented by putting women on a ketogenic diet. There's no I think, situation where you wouldn't want to put someone on a keto. Now, intermittent fasting is a different story.
Yeah.
But just a healthy ketogenic diet for someone who's pregnant, nutrient dense, the development of that embryo and that child in the first and second, third trimester, and then is so crucial to the bone formation, the future health. It's the most important thing. So if they're missing just even iodine, their IQ will be less than it should be. So you can optimize the full function of the brain, the nervous system, the bone structure to prevent all the dental work that they need, braces down the road. So it's the most important thing for someone who's pregnant to even start eating healthy 2 years before they become pregnant would be the ideal scene, and then they go into it. And then there won't be any risk of getting diabetes or prediabetes. If you're insulin resistant when you're pregnant, the odds of the child getting diabetes go way up. So it's really crucial. And then the breastfeeding is vital as well.
Yeah.
As long as possible.
Yeah. I've read a lot of research that's starting to come out regarding first trimester nausea and vomiting and how that puts people in a natural ketogenic state and how it can actually be beneficial. Have you seen any of that information coming out?
Absolutely, absolutely. A lot of the nauseousness comes from gallbladder congestion, which could come from a lot of things. But I think probably out of all the things that are the most important would be, of course, the folic acid, the B vitamins, but also the trace minerals, because you get that from shellfish and seafood. A developing baby needs the trace minerals for making proteins that are basically the worker machines that build body tissue. So if I was going to recommend any food, if you recommend shellfish for a woman who's pregnant, they're going to have the best chance of having the optimum nutrients, because not only do you have the trace minerals, but you have the omega-3 fatty acids, DHA, you have a lot of other nutrients, you have amino acids, which are really important, and then of course the leafy greens, which give you the vitamin C, and the folate, and the magnesium, which is really important, and the potassium. So you really need to keep that in there. But a lot of women, when they have certain cravings, it might not be the right type of foods to fulfill what they're really craving for, because the body cannot, like you might crave salt, for example, right? You have that perception. But when you need potassium, you don't crave potassium foods. You don't. So how are you going to get them? So it's a little difficult. You might just crave carbs when you need potassium. So when you actually give a woman who's pregnant more potassium foods, all of a sudden the carb cravings go away. So it's you really have to look at the whole picture.
So you're obviously a speaker at this conference, and you've just given a really interesting talk that I found fascinating. Obviously you've been in this a while, I'm sure you've been to other conferences, but have you got anything out of this conference yourself, or is there anything that you specifically find interesting about Low Carb Denver 2020?
I got a lot of ideas for future videos, because you get to hear the different viewpoints of the different speakers, and you get incredible ideas also just from talking to the lay people, the people that were there. I mean, just by talking to them, they tell you what people are running into. Just take a look at social media. Social media is a communication, two-way flow, and you really need to read the comments, listen to people, what they're running into, to be able to get ideas on what you should do and talk on. But the speakers were incredible. I learned a lot of things I've never learned before, so they gave me ideas to even dig more into the research. So it was a fantastic conference. I really appreciate Dr. Jeff for putting this on, and despite the stress of the coronavirus, and pulling off a huge win. There's, I think, 300 people that showed up, which is huge. And I think it's you get like-minded people in one group, and we get to share ideas and expand our knowledge, because we all know that it works. So why not strengthen that successful action of getting even more data and aligning and collaborating with other people. Now, I'll be honest, like not everyone is on the exact same viewpoint with every single thing, but we definitely have one thing that we all agree on, which is low carb.
Yeah.
So there's not anyone in the group that is like into high carb. They're not part of the group. So that's like the most important thing. And then, you know, you get different viewpoints, which expands your knowledge. If you kind of look at them and, you know, you have to have tolerance of other people's viewpoints. So anyway, I really liked the conference, and I'm glad that I came.
Yeah, me too.